Hey guys, I'm Nick Sanders, physical therapist with Fit for Function. And today I want to talk to you a little bit about knee pain and what we can do to treat some of those things and take some pressure off the knee so ultimately that knee's moving better and we can get back to some of those activities that we want to do and maybe feel a little limited with the knee. So there's a lot of different reasons we can get knee pain. Two of the most common are something going on with this inside or medial compartment, the inside of the knee here. You can get arthritis in that area that kind of compresses and irritates and inflames from time to time. You can also irritate the meniscus running through there. Two of the more common reasons you can get knee pain, there's multiple obviously, but in any scenario, the pain on this inside of the knee is going to be fed by this nerve that we call the saphenous nerve. So the saphenous nerve is just the sensory nerve or the nerve that provides the feeling and the pain information to this area. That nerve is going to come off the front of the hip, wrap down through the inside of the knee and all the way down actually the inside of your foot. So if you ever feel like your knee pain is traveling to your foot, that's why, okay? Because that nerve just runs all the way down through there. So if it gets irritable enough, you'll feel it traveling up and down, just following the power line, right? The other kind of common knee pain thing that we see a lot of is anterior knee pain. Now, anterior knee pain, like inside knee pain, there's a couple of different things that might be going on. Two of the more common are something going on with this kneecap or the patella. The patella is basically going to track up and down inside of the groove of your knee, and it basically follows a C-shaped pattern as it moves through there. And if something's off, one of these bones are rotated left or right, or there's some tightness in the quad, it can either compress the kneecap in that groove or cause it to track outside of the groove. And when it tracks outside of the groove, it rubs funny, gets a little irritated. So patellar or kneecap problems can be one thing going on. The other thing that can happen is you can get an irritation of the tendon, either the patellar tendon below the kneecap that attaches to the top of the bone. Usually that pain's going to be right on the tip of that bone or right on the bottom of the kneecap. It's going to hurt with things like running and walking, going downstairs, those types of things. Or a quadriceps tendonitis, tendinopathy, where the pain's actually on top, where the muscle of your thigh, the quadricep, attaches to the kneecap, or I should say kind of encapsulates the kneecap. But anyway, where that all comes together, sometimes that tendon will get tender right above the kneecap. Those are some of the common causes for pain on the front of the knee. This area in the front of the knee is also supplied sensory by that saphenous nerve, or the nerve that's running through the inside. It's going to feed information across the anterior knee as well. So one of the things that we can do to try to take some pain away or modulate that pain without medications and injections and all that kind of crazy stuff is change the input to the saphenous nerve. So what I'm going to do is I'm going to show you guys two techniques, one with the Hypervolt, one with the ball. We're going to work the same areas, but you're going to pick which one you want to use, and we're going to work through that area and see if it changes your pain. We always like test, retest. So what I'm going to have you do is just kind of move that knee. So we're going to go in and out, maybe do a squat, maybe try to put some pressure either outside or inside. Just see if you can find something that you feel the knee, right? Don't make it hurt, but just kind of see, okay, yeah, I feel it right there a little bit. We're going to do this technique, and then when you retest, we want to see if it feels any different afterwards. If it works, that's something that we're going to run with, right? That's an idea or concept that we want to go with. But the only way to know if it works is to test it and retest it. So let's pretend I have pain with knee bend. I'm going to bend my knee, see how far it goes, see what it feels like, and then I'm going to treat it, and then I'll retest. So first we're going to use the Hypervolt. Hypervolt's my favorite. I love this thing. I'm going to set it on the one setting, depending on which tool you have, might be the 5 or the 6, but I'm looking for an intensity that's somewhere around a 50% or a 5 out of 10 intensity, enough that I feel it, but not so much that it's bothersome. And I'm just going to start on my inner thigh. And I'm going to work through this inner thigh, and I'm looking for anything that's tender. So I'm going to start by just kind of scanning and looking around. There's a tender spot. So once I find that tender spot, I'm going to hold it for about 30 seconds. Okay? If I just hold there for 30 seconds, you're going to notice that the feeling of the vibration and the pressure will kind of desensitize that area. That's the effect I'm looking for. So I'm just going to hold that for 30 seconds, and then I'm going to scan and I'm going to move around. Okay? One of the other things that I can do here besides just holding for 30 seconds is we can do something we call a pin and stretch. So with the pin and stretch, I'm going to find a tender spot, I'm going to pin it, and then to stretch it, I'm just going to move my knee back and forth. Now this is a little more intense, you're going to feel it a little more, but same idea, you're going to feel it kind of loosen up as you go. So keep your pressure light, don't make it too intense. If you do happen to have a Hypervolt, it's got the pressure gauge on the back, so you can see these little white lights turning on. you're probably not going to want to go more pressure than a two lights. That's a lot. One or even none is usually enough. But just kind of working through there to see what she does. Okay. I can also go below the knee. You got to be a little careful around the knee. That bone in these massage guns, if you get too close to the bone, it'll bounce. I have the cushion setting on my Hypervolt here. It'll let me get a little closer to that bone without bouncing off the bone, which is always a nice thing. But I can work right through the outside of the knee here and just kind of make my way down. Again, find a tender spot. There's a good one for me, and I'm just going to hold for 30 seconds. Okay. Now, if you don't have a Hypervolt, A, get one. We sell them in the office or buy them online. B, you can do the exact same thing with a lacrosse ball. So I'm going to scan with the ball. I'm just going to put it in the palm of my hand, and I'm just going to roll it around until I find a tender spot. Boom, there's a tender spot. I'm going to put pressure. Again, I'm looking for that 4 to 5 out of 10 type intensity. There's my pressure. I'm going to hold, and now I'm just moving the knee back and forth. Okay. Same thing, move, find another spot, roll with it. Okay. Work 3 to 4 spots, 30 seconds each, a total of 90 seconds to 2 minutes. After you've finished with that release, recheck your range of motion, see if it feels any different. If it's feeling better, we know somehow or another that saphenous nerve is involved. Now, the real magic to this equation is figuring out why that nerve's irritated, where it's coming from, and the mechanics, the posture, the activity that's causing that irritation. And that's really our job as rehab professionals, whether you see us or somebody else. You want to find somebody that can figure out why you're putting pressure on that inside knee position, or you're putting pressure on that patellar tracking or those tendons above or below the kneecap that's causing that pain in the first place. And that's what we do at Fit for Function. We want to assess it, figure out why it's happening, get the pain to go away with these techniques as well as other manual therapy techniques that we do that may get into that area a little more specifically to help you feel better, but then also train and put a plan together to find movement patterns that take the pressure off of that knee. And that's ultimately what we want to do, because if we can fix the reason that's happening, well, now that knee pain stays away and you can get back into those activities that you love doing without being so worried it's going to bug your knee. So in any case, I hope you enjoyed the video. I hope these techniques take some of that knee pain away. If you enjoyed the video, give us a like, give us a subscribe, give us some feedback. We'd love to hear questions or comments about the video, things that would help you better perform these techniques. We'd love to know about it so we can make our videos better in the future. And then ultimately, we'd love to work with you, whether that's virtually or if you're in Northeast Ohio, come see us in one of our clinics. You can find us at fitforfunction.com. You can schedule an appointment from the website. You can set up a free phone consult with one of our therapists. We also have more great content and blog posts and podcast things that you can do to pick up more information, whether it's regarding your knee, your back, your hip, your headaches, any of those body mechanic type things that we can help you with. We'd love to provide as much education as we can. So find us at fitforfunction.com, and we hope to see you on the next video. I appreciate it.